Good afternoon. Dear participants, it's a real pleasure to welcome you to this session called Rethinking the Food, Staying Healthy in an Era of Abundance. This session is organized, as you know, as part of the 10th Moscow Urban Forum. And thank you all for joining today. And we very much look forward to a good session. My name is Mary Kenny. I work for FAO's regional office in Budapest, the regional office for Europe and Central Asia. I'm a delivery manager. I manage a program of work called Transforming Our Food Systems and Facilitating Food Trade and Market Integration, which includes work on food safety, which is my particular background. I'm really pleased to have an excellent panel of experts today, and I will shortly introduce all, and we will have very interesting presentations. I just want to make a few introductory comments just from FAO's perspective on this important session. From our perspective, you probably are aware FAO was founded 75 years ago this year. And the global nutrition situation has evolved and changed a lot in that 75 years. At the inception or the origin of FAO was at a time when there was a lot of hunger in the world. There was a rising world population. And the key question at that time was, how do we produce enough food to feed the population? And while the situation has improved in many regions of the world, we do know in our region, let's take a regional perspective of Europe and Central Asia, that there are still a number of challenges related to food security and nutrition. And every year, FAO publishes a regional overview of food security and nutrition in the region. And from the last document in 2019, we can see that overweight and obesity is a major issue in this region and is increasing in both adult population of obesity and also child obesity. And that will be a particular focus of our session today. I just want to mention, we also have other nutritional challenges, particularly in some countries in our region and some areas of the countries in our region. So we do have a problem still with micronutrient deficiencies, anemia in some countries, in both children and women. And we also have a lot of work still to do to ensure that all people can have access to healthy and diverse diets. Is really where we need to continue to pay a lot of attention. Let me turn now to introduce our distinguished panel of speakers today. I'm very pleased that we are joined by Dr. Yuri Poteshkin, Associate Professor in Endocrinology from the Russian National Research Medical University. We also have Karina Hawkes from the United Kingdom, and Karina is Director of the Centre for Food Policy at the University of London. We're also joined by Ms. Milka Sokolovic from the European Food Information Council, UFIC, and Milka is head of the Food and Health Science section. And we also have Mr. Niels Lund, who is Vice President of Health Advocacy at Novo Nordisk, a global healthcare company. So this is our panel of speakers. And what we would like to do now is to begin with Mr. Yuri Poteshkin. And Yuri, you're, as we said, you're an endocrinologist and also based in Russia. So we're very interested to hear from you as a medical person, as a doctor, about nutrition problems and what is the situation and maybe some of the issues that we need to tackle further. So you have the floor, Mr. Poteshkin. Thank you.
Спасибо большое, Мария.
Thank you, Maria, for this introduction. Greetings, colleagues and audience, participants of this forum. Let me tell about obesity in terms of looking at this problem as a doctor. Obesity, well, according to different data, it's always abnormal quantity of fat. Well, it's excessive fat accumulation, meaning that human has excess weight, and a lot of organizations point out that there is excessive fat. People eat a lot, and fat is accumulated. That's a conventional and old idea. It's a serious disease, and we see by epidemiology, it's not a local problem, but of the developed world, where you have enough food and enough money to buy this food. It's a world global problem, and as you see, in 1975, the obesity problem was present, but it was not so prominent, so to say. However, the trend towards 2014 increased, and what is interesting to note that these countries, well, first of all, developed countries, European countries, Russia, and besides, we see the increase in African countries, in America, in the United States. You do not see any country, practically no country, where this problem is not present. Well, and as it turned out, the obesity problem is not characteristic of rich countries, but of the whole world. While rich countries have an option to have a varied diet, poor countries do not have this choice, just fast food, calorie-rich food, and of course a lot of nutrients. And finally, with countries like Mexico, second place after the United States in obesity, so it's unfortunately not connected with the well-being of the population. It's connected with the policies of the recent years, and everyone is familiar with this problem, and almost all the countries are trying to solve the problem, creating certain conditions for the people to move and walk more, to change their diet, perhaps try to exclude some of the products of their diet, or organize some courses trying to familiarize people with a healthier diet. And is how we have come to it. Well, in the middle or in the beginning of the 20th century, there was a trend to be less physically active, and it was a parallel trend, and to eat less. And the weight was normal, but after the 60s, 70s, the nutrition was calories rich, and the trend towards less physical activity continued. And afterwards, we have seen the change of the direction of the vectors. Of course, it has certain impact on the burden of the national health services and the expenditures. For instance, in the US, almost $650,000, and obesity problem is not just to get rid of excess weight or to, as you see in Russia, there are plans to spend about 7%, in the UK 8%, and to improve the diet. It's a global problem. Well, let me tell you some words about why this problem persists. It's pathogenesis. Why obesity and what problems are followed by this? Well, in terms of metabolism, not everything is shown in the slide, but there are different pro-inflammatory reasons. For example, activation of macrophages, infiltration of fat tissue, and macrophages lead to inflammation. So it's a vicious circle. It's a kind of loop. And when there are inflammations and pains, then you see adaptation to this process with some resistance, tissue insulin resistance, due to quite thick walls of fat. There is a resistance, but it is simultaneous with inflammation. What do we have for regulation of such processes and control? We have leptin, which is meant to, to stop development of appetite. Unfortunately, with insulin, it does not occur. With a stable increase, we see leptin resistance, which results in such processes as the influx of FA oxide, and then we see changes in all important insulin-dependent tissues like pancreas, in vascular, which is fatal for the future. When N-oxide production is reduced, which means that the vessels, the pressure in the vessels increases, and the higher the pressure, it's worse. Glue-induced insulin release, we see the split because of the processes make it produce more insulin. In skeletal muscle, we observed similar process, less intake of glucose intake, and then we see another vicious circle. So it's a great, large, vicious circle. It's becoming a global problem for a human person. With liver, we see the following processes: the reduction of glycogen synthesis and the increase of glucose production, and which changes the resistance, which is quite bad. And we see different after effects and complications. What are the major after effects for us endocrinologists, because it's very close to us? It's heart problems and vessel problems, diabetes and hypertension. For us, it's these are diseases go hand in hand for patients with diabetes and hypertension, dyslipidemia, So it's a great problem, and diabetes is a large social problem. Then, parallel, we see non-alcoholic fatty liver disease, or steatosis, steatohepatitis, or even cirrhosis, depending on the time person stays in this condition. Then it may also result to heart strokes, heart attacks, then different types of hypertension and obstructive apnea. And then also there might be, because great load to limbs, it may result in arthrosis, and since the fat stops or prevents normal influx in the veins, then we see insufficiency in the veins, and with such a diet, when you have overeating, then you have a gout also. And the previous slide also showed some information about cancer and the consequences. The problem is that obesity is included by World Health Organization into the list of diseases that cause cancer, and cancer of all the organs and all systems. Cancer in the tissue of covering brain and spinal cord, and other oncological diseases as well, and which means more money-consuming solutions. How do we see the reasons? Well, normal reasons. Well, overeating. Well, as you see in this slide, overeating, overweight, social-cultural activity. The reasons for it. Overeating and physical activity, two poles, and the first place is social-cultural reason, which you see on the right. So theoretically, by changing our, so to say, habits and well, aspects of life of people, depending on the cultural habits of this or that country, making their food diet more attractive. If we impose different restrictions and bans, it won't be good. So in general, that is to say, well, I'm not going to expand, well, how to prevent obesity. Well, on the level of physical activity, certain increase to stimulate people to move. They may be different programs, urban programs, when persons are tempted to walk, to go on foot to their office, and to see some landmarks and sites, and nutrition. We have a lot of large companies with food courts, canteens inside. And in Russia, I saw that a lot of corporations and companies are trying to implement new principles. But it's not all. We can also use different awareness-raising campaigns, educational programs, and of course, new social conditions during work that stimulate to get rid of some of the things in their diet. Obesity treatment in general. If we see a patient, we offer three options. If he goes or she goes to a doctor, so prevention plan did not work. So we start to educate our patients, because patients do not understand how to correctly eat well. It's not about light athletics that may make you fit. Then medication. We have some medicinal products that help reduce weight, but not all of them. Well, they can help change the energy balance. Well, and this area is being developed more and more, and there are different medication for glucose and fat, but people adapt quickly and stop eating, which is not so good for them, and these products, medical products, are not so useful. And one of the methods which for doctors can be motivating factor when the patients follow recommendations, surgery. When people with overweight hope to get a magic pill, and this pill will help him reduce a lot of weight without any efforts. And then patients are very surprised that they have to put a lot of efforts. Well, of course, if we don't get less weight in several months, we can have some surgery, and you will have less weight, but with some complications and risks. And they understand that the problem is serious, and they become more concerned and attentive. That is all. Thank you for listening. Well, you see our list of our literature. Thank you for listening.
Thank you. Thank you, Dr. Poteshkin. Thank you very much for highlighting a number of important points, but also including the links between obesity, overweight, and other health effects and outcomes. And you also started to talk about some of the solutions in terms of education and preventative approaches. So I think this leads on very well. I can ask you to stop sharing your screen, please, so that we will move next to Karina Hawkes. Karina, I think you can follow very well from that to share with us further your work that you're doing related to child obesity in the UK, in London. You're as Vice Chair of London's Child Obesity Task Force. And we know that you're also doing a lot of work on policies to improve the quality of diet. So, Karina, over to you, please, to tell us more about the London programs being launched on child obesity in particular. Thank you, Karina.
Thank you, Mary, and thanks very much for the invitation to present today, and good day to everyone who is listening. It's an honour and pleasure to be here in my capacity as Vice Chair of London's Child Obesity Task Force. My main job is of Director of the Centre for Food Policy at the University of London, and I have the Vice Chair role as an honorary position, and have been leading on the development of a plan for London to address obesity, and become firmly convinced through that process that cities are a superb entry point for tackling obesity. So I'm going to share with you some of the work that we've been doing in London to prepare a plan that can be rolled out across London to tackle obesity, with a particular focus on addressing inequalities in obesity. Because what you can see here is that the problem is much greater among children, and I'm focused on children here, among children who experience deprivation. We are very fortunate in the UK to have extremely good data on the association between obesity in children aged 4 to 5 and aged 10 to 11 and deprivation. And that's reception age is 4 to 5, year 6 is age 10 to 11. And you can see here that the most deprived children in age 10 to 11 have 47.6% overweight and obesity, compared to 24.9% in the least deprived. Of course, that is very high in the least deprived as well. So this is a problem that goes across London among groups of all socioeconomic status. But you can see just how stark the difference is between the least deprived and the most deprived. So what we did at London's Child Obesity Task Force is to ask, what is it that we can do to address obesity among the most deprived children in London, those with the lowest levels of income, who live in places which are not well served, and come from households who face challenging situations with regard to employment and so on. And to answer this question, we went to speak to children, because we believed that taking a child-centered approach was the most effective way to understanding what is really going on in cities, and to understand how to tackle this issue of urban deprivation from an obesity perspective. We spoke to children, we spoke to their parents, we spoke to local authorities, local governments, of which there are 32 across London. London is divided into many different smaller areas, being such a large city. And we spoke to people who engage every day with children to really try and understand what makes it so hard for them to be healthy, to eat right, and to be physically active. And what we found was disturbing. It's disturbing because we believe that children have a right to be protected and supported in their health and development. We found, and we put it together into 4 different children's profiles, and I'm showing just one here, difficult to read, but let me emphasize a couple of points. We found that the child's sleep is often disrupted because people live in poor quality housing. So when they wake up, they're not so much in a good mood if they've slept well at all. It means that the demand and desire to have something quick and easy and sugary when they walk through the streets that morning to nursery is very compelling, especially when they have very poor facilities at home to prepare food. And it means that once that they get to nursery, even though in London we have programs to provide healthy food, their exposure to that food has been so low that they haven't developed a taste for it. It means that when they go to parks and leisure, they're very tired by the time they get there. And that makes it very difficult for them to participate. And it makes likely that very young children will start to cry and have a tantrum. Because it's so difficult to eat well at home, it's easier to only just heat food up in a microwave. So this combination of poor quality housing, of very low income, of the widespread availability of cheap and sugary snacks really makes it harder for these children to be healthier and also to participate in programs that are designed to help them. And what this shows is that they need resources, money and capacity, skills, assets, and financial resources that give them capacity to live better lives, including education, but also skills, assets, and finances. It means they need a better environment. Children of all ages need to be surrounded by a healthy environment that helps them eat healthily, to drink water and be physically active. And it means that those kids need care and emotional support. So the situation in London is that there are already actions that have been taken to provide children with these resources, emotional care and support, and with a healthier environment. There are leisure centres that have been contractually obliged to provide healthier options. There are apps that are available in schools through digital means to incentivise kids to be healthier. There are programmes like the Daily Mile championed by our Mayor, Sadiq Khan, who has to encourage physical activity. There is a restriction on unhealthy food advertising on the transportation network. There are investments in new playgrounds. There's a quality standard that incentivises fast food outlets to provide healthier options. There are schemes to shut off streets to traffic to encourage kids to walk to school. And there are healthy early years programs, such as the one I mentioned, which is all about providing healthier food in early years, and another one in schools. And there are even London boroughs, of which there are 33, that have attempted to take a whole systems approach in which they are targeting multiple elements of this problem to target children's lives. because that's what we want to see. We want to see actions at multiple levels working together to reinforce each other, to reshape what children eat and drink, to reshape the different elements of their lives. It means connecting these existing actions to create a greater consistency and coherence in these children's lives, and to identify actions with ripple effects across the system to change the reality of those children's lives. But what we found when we looked at those existing actions is that they were too small scale. They were too piecemeal. They weren't long lasting enough. And they weren't designed in a way that could really make a difference to those children's lives. So take Justin. He hasn't had that life opportunity to be exposed to healthy food. So that very well-intended program in that nursery to provide healthy food really needs to be accompanied by a taste education program to expose him to that healthy food so he learns to like it. And we know that the evidence is there for those types of programs. So what we did in the London Child Obesity Task Force is to look the situation that children really faced in London, both in terms of how hard it is to be healthy, but also the actions that are already going on, and saying, from the child's perspectives, what do they need to bring them the resources, to change the environment, to give them the care and emotional support that we need. And we developed 10 ambitions for London's children, which are listed here. It's about providing support for parents. It's about making sure that nurseries and schools are fully equipped to do what they can do. It's disincentivizing companies from pushing the unhealthy foods on these kids. It's making sure that families can afford the healthy options. It's making sure that London is providing free water for kids so they're not going towards these sugary drinks. It's making it easy for mums to breastfeed at the youngest ages. It's giving older children social spaces where they can hang out with their friends and eat healthy food at the same time, and making sure that streets are safe for children. It's incentivizing businesses to do the right thing. And we encompass, these are the ambitions which are listed here in their specificity. And each one of them is accompanied by 2 extremely specific actions, very actionable, in which we name particular actors that should be doing particular things. So that's about calling on the mayor to increase the number of employees becoming living wage accredited, for example. It's about introducing peer-to-peer support networks for breastfeeding, which we know work in London. It's about introducing training schemes in early years. I won't give you all the specific actions, but we name specific actions that can be taken across all actors in order to affect real change in real children's lives in London. If you're interested in finding out more, we do have a website where you can identify and download the various documents I've talked about today. Thank you very much.
Thank you, Karina. Thank you very much. I think you hit on a number of really key points that we hear a lot about them as we try to address the multiple nutritional challenges we face in the region. The importance of the people-centered, and in your case, the child-centered approach. I think the systems approach is a very, very key, as you highlighted, to avoid, let's say, ad hoc or short term. I guess the thing about nutritional information and obesity and all these things is that we continually have new people and young people, and so we have to continue this work to ensure that the good messages are out there, but also that the environment is there, as you said, for people to overcome these inequalities. And that was the other point that I think you really left us with, a strong importance of looking at inequalities. And you also raised affordability of diets as one of these angles of inequality, but you raised many. Karina, thank you very much. We'll come back to some of these points, I hope, if we have a little bit of time towards the end. Next, I would like to introduce our next speaker. I'm really pleased that we are joined with Mr. Niels Lund. Niels, you are heading up the Cities Changing Diabetes program related to your company, and you're very much involved in healthy lifestyle promotion as well. So I think, again, let me give the floor to you to share your experiences, and I think you're putting a particular spotlight also on diabetes, a very important and challenging issue. Over to you, Niels.
Thank you, Mary, and thank you to the other speakers. I think we're deeply inspired what is going on in London because of the many interesting actions that are being done at various levels. I'm the global lead for Cities Change Diabetes, a public-private partnerships for 36 cities around the world, from China to the US, Latin America, Europe, and so on. If COVID-19 is a pandemic in fast motion, diabetes is one in slow motion. It's interesting, over the past 2 decades, diabetes prevalence has more than doubled and is continuing the upward trend, so that we by mid-century will probably have something like 700 million people living with diabetes. Often half of them will not even know they have the disease. So it's diabetes, as I think everyone knows, is not just a serious chronic health condition, but it's also a great burden for society and for economies around the world. Well, on the brighter side, most cases of type 2 diabetes can be prevented. I'm not saying it's easy, but it is possible. And the key to that is addressing obesity. Without addressing obesity, we will see the upward trend as I've shown in this picture. But if we are able to reduce obesity by 25% over the next couple of decades, we can actually keep diabetes, which is a driving factor between many debilitating illnesses and also mortality, and we can keep that diabetes in check. So there are many factors with diabetes that are not modifiable, but there are some that are. And obesity is the single largest modifiable risk factor for diabetes, and that's also why diabetes and obesity belong so closely together. And even though we call our program Cities Changing Diabetes, it could also just as well be Cities Changing Obesity. So what is it that why are cities interesting? Corinna also alluded to it, but first of all, it's a place where many people live. More than half of the world's population live in cities today, and that urbanization is expected to continue over the next decade. So 2 out of 3 will be living in cities by mid-century. But already now, 2 out of 3 people living with diabetes live in cities. And that is also expected to grow to 3 out of 4 by mid-century. And why is that? Well, it's because cities influence how people live, work, eat, and play, and they all have an impact of obesity and diabetes. Sedentary lifestyles, a lack of physical activity, long commutes, time poverty, unhealthy food environments are the common risk factors for developing obesity in urban settings. While it's difficult, it's not easy to change the it's not easy to change the transportation system of a city or improve the environment more generally, but eating habits are usually perceived as a personal choice and responsibility. But is that correct? But actually, in reality, food choices are a result of multiple intertwined and codependent characteristics: society, culture, environment, socioeconomic status, family structure, and individual preference. A big bag, as also the case from London suggested. And if we've illustrated in this way, food is of course biological. It is a source of nutrition, and that's also why we eat. But there's so much, in the iceberg below the water. First of all, food is social. In our research around the world, we find everywhere that people say when we meet, we eat. So food is a social fabric where when we meet each other, it's with a plate out in front of us to welcome people. But food is also culture. the tastes and certain foods that we keep with us throughout our lifetime because they remind us of good times when we were children or throughout in life. And while it's maybe easy on the nutrition side, the top part, the biomedical or biological factors, while they might be easy, it's much more difficult to address the social factors and the cultural factors, certainly, and not least also the economic factors behind this. So we believe that diet, like many other behaviors, can be examined through three layers: the individual, the family community, and the socioeconomic layer. All three layers affect the way individuals develop their eating habits, how society forms its attitudes towards healthy food choices, whether they address the problem of obesity or not. And the outer ring authorities should also be involved in addressing the modifiable risk factors for diabetes and obesity, such as unhealthy diet, by improving food environments. We heard from London. I think there's also an interesting case from Mexico City, where they back in 2014 implemented a tax on non-alcoholic drinks with added sugar. And taxes do work. There are economic incentives, and we've seen that the consumption of these sugary beverages have fallen. There are also other experiments around the world, some successful or not, but all of them deeply unpopular. And I think it's also sometimes it takes political courage from decision makers and politicians to actually invoke some of these tools in addressing the diabetes and the obesity epidemic that we see. But I think we are a lot of actors, both in academia and civil society, and also in private sector, who are willing to help address these factors and also help make the more difficult decisions that governments need to take. So how can we positively impact the diets of communities and individuals? Well, there are three driving forces that inform diets: the food industry and how producers price, place, and promote their products. Not always in the most health-promoting sense, so that must be addressed. That can and should be addressed by government, which is responsible for regulation and law, fiscal policies, health promotion policies, both the carrot and the stick related to this. But I would also, plead for the understanding of the importance of addressing societal and socioeconomic, sociocultural norms and beliefs that, as I explained before, form traditions, cuisines, cultural and religious values and practices. If we want to address the problem of unhealthy diets, I think it's essential that we take action on every possible level. I think also in Russia, in an adjacent area in alcohol consumption, the case suggests that there's not a quick fix or a simple solution to a problem, but rather it's a broad spectrum that you need to implement policies, apply the carrot and the stick, and work with behavior that actually will actually, in the case of alcohol consumption, reduce the alcohol consumption. And I think there's a lot of important lessons to learn from when we look at diets. And maybe this is one of the key challenges of the coming decade. So thank you for listening and also engaging in this debate. We have a lot of work ahead of us, and I'm looking forward to the continued discussion. Thank you.
Thank you very much, Niels. Thank you for adding your perspectives and really also highlighting the seriousness and the challenges of the diabetes, but also giving some hope on some of the on the way it can be addressed, or obesity can be addressed through a multifaceted and different layers, as you said, everything from the individual to the talk on the food environment and policy. And I think you know, a lot of your points resonate very much also with the talk of a systems approach and different entry points, if we want to say. Thank you again. And now let me introduce our final presenter today, Milka Sokolovic. Milka, you are working very much on nutrition and health issues at UFIC, and I know that you're going to look at more on communication issues and engaging different stakeholders, showing the role of personal behavior, but also many other factors as well. So over to you, Milka. Thank you very much. And we have, if you can keep it timely. I realize we're now already at 11:15. Thank you. Over to you, Milka.
Thank you very much, Mary, for your kind introduction. And большое спасибо to the organizers for the invitation. It's wonderful to be in the great city of Moscow again, even if only in our minds. And it's really an honor to be a part of the 10th Moscow Urban Forum. I hope that in some minutes from now, you will be all convinced that science communication as a tool in stakeholder engagement will be instrumental in increasing the impact of nutrition science and in making a difference to public health. Now, the speakers before me have greatly helped me by sketching the world that nutrition science operates in. And I will touch here only on two. The 21st century is characterized by the triple burden of malnutrition. Out of 7.6 billion of us, about half is malnourished. 1.9 billion suffer from overweight and obesity, as Yuri was talking about. 2 billion from vitamin and mineral deficiencies. 815 million people suffer from chronic hunger. And according to the FAO data, last year that number was on the rise again after 10 years of stagnation. And COVID is only exacerbating the challenge and across all nutrition challenges. If we zoom into the WHO European region and Central Asia, as Mary was referring to, we realize that 57% of people in the region, marked in yellow, live with overweight. In 5 out of 53 countries, more than 5% of population suffer chronic hunger. And there are countries marked in orange that suffer from the triple burden of malnutrition. But then there are also the so-called less concerned countries in green that have moved to the next phase of nutrition transition, which is characterized by the reduced fat consumption, by increased fruits, veg, carbs, and fiber consumption, and by replacement of sedentary lifestyle with purposeful recreation. And that is exactly what food-based dietary guidelines, which we now have in almost all the countries in the region, advise us to do to ensure this transition. But if we look into the burden of disease data from May 2019, it is exactly the behaviors opposite from the advice that cause the highest mortality rate attributable to individual dietary risks. It is the diets high in sodium and low in whole grain, fruits, veggies, nuts, seeds, fiber that are the highest contributors to food-related morbidity and mortality. Of course, the reasons for this are multiple, but we can also nothing but conclude that there is a gaping hole between the advice and the action. And that leads me to another aspect of the world that nutrition science operates in. People are now exposed to a seemingly unrestricted access to information from more sources than ever in our history. And in addition to immediacy of information, we see a prominence of digital technologies and social networks, proliferation of mobile and wearable devices, and rapidly expanding connections between devices and objects. Many of the information sources offer inaccurate, contradicting information in which science gets misrepresented, be it on purpose or due to ignorance. And that leads to confusion and eventually a decrease in trust in the food value chain and in nutrition science in particular. And trust is central to how we interact with others and a key to positive relationships and behaviors. And it becomes even more critical in periods of uncertainty like the pandemic that we live in. So what is it that we can do to close the trust gap? How can we translate nutrition science so that people can make sense and use of it? And is translation sufficient? Before we dive into it, we need to appreciate the differences. Research has shown that even the basic concepts and terminology in nutrition science, like healthy or nutritious, land with lay and professional audiences differently. So our food-based dietary guidelines can be understood by policymakers, for instance, but not by general public. So we must be cognizant of these differences, open to what people really want to know about, and adjust our talk to their needs. However, as soon as you scratch under the surface, you realize that science communication is a whole science on its own, from setting the scene to describing the research, each with their own technical aspects, and some of those can be complex. They take time and resources, and I'm sparing you the details here. But even if we leave the proper science translation to professionals, if we are to increase nutrition knowledge and message uptake, we must all bite the bullet. By we, I specifically refer to scientists and health professionals. And really, in simplest terms, for a successful nutrition science communication to impact across sectors, we should all be able to define a limited number of simple, actionable messages, set values and tones according to the audience, use the right channels, align among stakeholders, and in doing all this, be consistent and persist. And whenever possible, go visual. And that is because we, people, retain 80% of what we see and only 20% of what we read. And we process visuals 60,000 times faster than text. On top of it, it is our attitude that matters. We should be where the discussion happens. We should talk with and not at people. And we should not be shying away from emotions. Now, we must acknowledge that nutrition knowledge and health literacy, while important, are not critical for people's behavior. To really change the behavior, we need more than improved science communication, and the previous speakers were talking about it. We need a shift towards more healthier food choices, more exercise opportunities, more other products and services to facilitate healthy and sustainable choices, and then especially in urban environments. I would dare to say that we need a paradigm shift in thinking and acting towards healthy, sustainable diets, which takes a concerted effort across the board. And that is where stakeholder engagement comes into picture. And by stakeholders, I mean anyone that can affect or is affected by nutrition science communication, either to satisfy their needs, to gain their approval or support, or to minimize their opposition or obstruction. And each of the stakeholders has different needs to be satisfied, which I just briefly listed on this slide. To achieve coherence in nutrition science communication, it must be about more than only health benefits. It must enable an open dialogue. It must create atmosphere of trust and transparency, identify challenges and opportunities across sectors, highlight co-benefits to ensure a buy-in, ensure alignment and consistency of messages across sectors, and strike the balance right and focus on positive messages. And then once aligned across sectors, nutrition science communication facilitates stakeholders in fulfilling their role, from governments and public health authorities to engage stakeholders and reach the public health targets, over companies to strive for optimization of their products, healthcare professionals to educate the public and drive the behavior change, media and NGOs to work in the interest of people and support raising population awareness, all in order to help people to make healthier lifestyle choices. And we have seen a wonderful example of how this systems approach could work in Corina's presentation on London Child Obesity Task Force. So I would say if we are looking to increase the impact of nutrition science, we must make that extra mile. We must think out of the box, get out of the nutrition silo, team up with people, in terms of science, think of behavior scientists, psychologists, educators, communicators, environmentalists, food system scientists, but also across sectors. We must focus on constructive collaboration and common interest and work towards co-benefits rather than trade-offs. So thank you for your attention.
Thank you very much. Thank you, Milko. This was Milka, pardon, sorry. A very good final overview, stressing again, highlighting the triple burden, which we do know in our region of our program countries in Central Europe and Asia, where FAO is working a lot, is really an issue. Please, you also mentioned food-based dietary guidelines. Yes, many countries have made good progress in this area, but again, we have a number of countries in our region where we are continuing to work and have the adoption of food-based dietary guidelines and increased use of them. We have a few minutes left, so I think we can try to have a bit of a further exchange. Milka highlighted this issue of it's important not to only focus on the health benefits to try to convince behavior change. And I was interested, you're alluding then to a more systems approach again, and we know there's a lot of talk about sustainable food systems now, and yes, having the nutritionists talking and working with other actors in the food chain. So I was interested to hear from other panelists, any other perspectives on this, and Niels has his hand up, so I'm going to stop talking. Niels, come in, please.
No, but I think that Milka make a very, very important point about the role of social media here and how difficult it is. I'm always struck with, and maybe you can do that after the session here. If you Google obesity, so the disease, you get a very list of science-based information here. But if you want to do something about it, and then you Google weight loss, you get all kinds of stuff. And something, if you want to act on obesity, that's where you go for weight loss. And I'm just, it might be an uphill. And for a company that has their motto as do the right thing, I think that's also important to engage with the social media platforms that are so dominant in our information searches here in trying to do the right thing, and then also provide people with solid advice about how they actually might be able to do something about the situation there. Thanks.
Thank you, Niels. Thank you for raising that comment. An important issue in terms of information and having reliable sources and clear information, as Milka also raised. I don't know, Karina, you talked a lot about the London experience. How transferable are some of your experiences, particularly again, if we look at urban cities in other countries over towards the east of Europe? Can lessons be learned?
I think there's a lot of differences. Of course, there are lots of differences between different city contexts. But I think what is transferable are the principles that I spoke about. So taking this child-centered approach of understanding children's lives in the cities that decision makers are sitting in, and focusing on where the problem is greatest. And this idea of trying to take this systems approach where you're trying to connect and build on actions to influence resources, influence care and support, and influence and change environments, and not just focus on one part. So I think these are the principles that should be shared across all cities. And I think the general approach that we used in London is transferable, even though the specifics of what might be done would vary between cities.
Can I ask, our session today is very much on obesity in the urban context. Do we really think this is the key challenge, nutritional challenge to cities, or are there other important, maybe Yuri wants to come in on this from your context in the Russian context? Is it really obesity is the number one challenge in the urban context, or other issues that you think also need to be addressed?
Ну, вы знаете,
You know, well, obesity is directly connected with urban population, and actually a city. Why we are talking about city and obesity? Because these two components are interconnected and interdependent, and the way the city is organized, the way people live there, and it's obvious. And another important point, I've failed to mention it, but when we meant some points about prevention of obesity, when we don't people don't have opportunity to maintain healthy weight, and the doctors come in. Well, the effectiveness is low. Only 20% of the patients are successful due to our efforts. And the reason is, as a doctor, I can say, if there is a certain way, well, to completely ban some bad food, like fast food products, I would do it. But the problem is that people would be indignant and would be against. We are trying to get them healthier, but then they will object by saying that you deprive us of tasty food, and there is much influence of the environment in the cities, and yeah, that's right. Obesity is determined by in the city by its environment. It's a very known story. Well, we do have other challenges, but they are part of obesity. They are connected with obesity and oncology, but they are not so frequent. They are more rare.
Okay, thank you. Yuri raised there the issue, and others, you've also mentioned it, a few of you, in terms of banning or the sugar tax. What's the feeling, and is this a valid and an essential part of the multi-pronged approach to deal with obesity or to encourage healthy diets? What is the feeling from different people's point of view? Would you be encouraging policymakers to definitely have some of these bans as part of a multi-pronged approach?
I can come in there just very briefly. I mean, London, the Mayor of London instituted a restriction on advertising on unhealthy foods on transport, on the public transportation networks and bus stops and so on, which makes up 40% of the land in London that is under his control. And what we've found with that is that that hasn't dented the advertising spend, so it hasn't had any kind of negative impact. But it is something that can be done at a city level, because most of these types of regulations are done at the national level. But there are also, and it varies between cities, it depends what kind of control the city government has on these areas. I know that some city governments have the power to tax foods. That's not the case in the UK, but it is in some other countries. So I think it really depends on what power the city government has. And we mustn't think it's a silver bullet. It's about trying to create a healthier environment in which then more nutritious foods and healthier foods can be introduced. It's not a silver bullet on its own, but it's certainly something that in London has been seen favourably as a way of enhancing the healthiness of environment for London's children.
Okay, thank you, Karina. Okay, Milka, I'll let you have the last word, and then I do have to very quickly wrap up. I've been advised we need to, unfortunately, close the session. Milka, okay, please have the last word.
Thank you. Just one quick point, and that is, I think it's really critical to have a systems approach in tackling this issue. And I would say the very fact that the Secretary General of the United Nations is convening a food systems summit next year only underlines the importance of the food system in all things around us, from health over environment, over livelihoods of people, over minority issues and what have you. So I think also coming from a background of system biology myself, I find the systems approach the only way for us to tackle this crisis, and the crisis is huge.
Good. Thank you, Milka. I'm pleased that you raised the UN Food System Summit. I was obviously going to mention that in my closing. I also I think that's a really important, let's say, focus for countries in our region. There's a lot of work started on the country dialogues and preparing for the UN Food System Summit to be held next September in New York. I also want to mention that at regional level, we had at the FAO Regional Conference for Europe, we had a big discussion. The main focus was on sustainable food systems and healthy diets. So there's a lot of commitment in the region and a lot of interest to cross from West Europe right through to the Central Asian republics to really try to put energy and practical focus on the systems approach, as many of you have shared real examples about today. So I think we're going to conclude. I want to thank you all again. I think a key message also from you was that lessons can be learned and principles can transfer, but obviously it has to be very specific to the city or to the context. And I also like the comment of trying to work to a system so that we have the nutritionists working with the agronomists, working with the economists, and all vice versa through a system, that this is the way that we bring food, people, and healthy outcomes together. And through public and private support and academia as well. I think this is very, very key as well. So let me thank you all once again, and let me thank the organizers of the Moscow Urban Forum and congratulate them on their 10th event and a very successful event online in extraordinary circumstances. So I hope maybe we can join them physically next year at the 11th event. Okay, so thank you once again, and I'm happy to close the session, and thank you all for very interesting contributions and discussion. Thank you very much. Have a good day.
Thank you very much.
Thank you.
Okay.
Bye-bye.
Thank you.
Bye-bye.
Bye-bye.
Thank you very much. Thank you. Bye-bye.
Thanks, Karina. Bye-bye. Thanks, everybody.